Hello everyone, this is Dr. Abhinav. So in this video today, I'll be telling you about the FMGE exams most repeatedly asked topics. So I'll be telling for the all 19 subjects. The importance of these topics is that if you know all these topics that I have listed here, you can easily clear the exam and score a very good mark. So how to prepare these topics and for whom these topics are is that if you have already prepared from the past 3 to 4 months, then make sure after you complete your complete preparation, and when you do your revisions, you focus more on these topics especially. But if you are someone new, if you are going to start your preparation now, then you should complete at least all these topics and revise at least once all these topics. So if you have already started your preparation, use these topics in the revision. But if you are starting new and you don't have enough time to cover the entire syllabus, in that case, at least know all these topics and revise all these topics at least once. And yeah, so before we start, if you still haven't subscribed to your channel, please do subscribe. And make sure you join the Telegram group also. The link is in description. You can post your queries and your doubts there, or you can direct message me in the Telegram group also. So make sure you join that group. And let's start. So this is the FMGE ebook 150 and above. So this ebook will have all these subjects, important topics that I am listing here with answers, so that it will be easy for you to study. With this, I'll provide a free one-liner book and test series every week, which will be acting as your Q bank, especially for your revision. So if you want this, you can get it. The link is in description. This is for INI-CET and NEET PG preparation ebook, and this is for UPSC CMS preparation ebook. So these are about the books. So to start with, in anatomy, make sure that you know about the embryology, especially the third week, all the findings that are seen in third week, and about the fertilization, the dates. So all those things are very important. Female reproduction, male reproduction, fertilization, the zygote formation, all those things are very important. Then cranial nerves and its pathways. So you should know about each cranial nerve from its origin and where it courses through, and if there is any problem in the cranial nerves, what are the diseases that can be seen. Then skull foramen and its contents, that is very important. Muscles of mastication and extraocular muscles. Triangles of neck and what does it consist. Upper limb neurovascular supply. So make sure you know about the upper limb, which nerve supplies which muscle, and what findings can be seen if there is any problem with that nerve. And about the arterial system, the division, the first branch, second branch, third branch, which branch gives what, all those things are very important. And the same for the lower limbs also, neurovascular supply, especially the foot drop, wrist drop, those kind of things are very important. And embryology of heart is very important. Inguinal canal, femoral canal anatomy, pelvic muscles anatomy, GIT embryology, blood supply of especially the stomach, intestine, brain and heart. So make sure you know the circle of Willis very well. In physiology, cell membrane, cell junctions, cellular fluids, skeletal and smooth muscles, all the points. Motor and sensory pathways of the nervous system, cerebellum, ECG, EEG and sleep. EEG findings is very important, and sleep type of waves is very important. And then lung volumes, pulmonary ventilation and circulation, JVP and cardiac cycle is very important. GI hormones is very, very important. Make sure you know which of the hormones do what action, what type of cells does it come from, all those things. GFR regulation, thyroid and adrenals, nerve fibers. It's also very important. In biochemistry, DNA replication, transcription, and translation, fed versus fasting state, the insulin and glucagon actions. Make sure you also know what pathways occur in anabolic state and what pathways occur in catabolic state. Glycogen metabolism and glycogen storage diseases, synthesis of ketone body and fatty acids, amino acids and urea cycle, all the vitamins and its diseases is very important. Heme metabolism and genetic diagnostics such as PCR, blotfish, and CRISPR, lysosomal storage disorders and dyslipidemia, all the different types of lipid disorders and lipid metabolism pathway. In pathology, it is very important to know the slides and the images. So make sure you go through all the images as much as possible in pathology. And topic wise, cellular injury and inflammation, both acute and chronic, neoplasia, all the basics. Genetics, types of inheritance is very important. Most of the times you get a question in this. Amyloidosis and the type of amyloid seen in each disorder. Colon polyps, it's very, very important. Liver cirrhosis and non-alcohol fatty liver disease. In renal, nephritic and nephrotic disorders. CNS tumor, mostly they ask about the most common tumor in children and adults and the important findings seen in each types of tumor. So know about the basic peripheral smear images, how to identify lymphocyte, how to identify neutrophil, all those things. In RBC disorders, hereditary spherocytosis, G6PD disorder, sickle cell anemia, thalassemia, and iron deficiency anemia. WBC, all the leukemia and lymphoma and myelodysplastic syndromes. The hematology is everything is important. That's why I've mentioned all the leukemias and lymphomas. Platelets also completely. So most of the time you get a question in platelets, and the topic is in itself is quite small compared to RBCs and WBC, but you get a question in platelets very often. And make sure you know about the blood transfusion, the basic reactions occurring, and massive transfusion protocols, all those things. Pharmacology, general pharma, the absorption, dispersion, metabolism, excretion, the important curves and graphs in general pharmacology, and adverse drug reactions. In autonomic nervous system, you should know everything, autonomic nervous system. In cardiovascular system, the antihypertensives and its side effects, CHF, congestive heart failure drugs, and antiarrhythmics. Usually you will be given a ECG and you will be asked what drug will you manage with it. So you should know about the arrhythmias and antiarrhythmics as well. In renal, diuretics, side effects mainly. In CNS, antiepileptics, opioids, and antipsychotics. Basically, they ask the side effect, or they will give the drug name and will ask which class is it from. Antimicrobials, everything, mechanism of action, side effects, and drug of choice. Mostly questions are framed that way. So they might give 4 or 5 mechanism of actions, and they would have given one drug name and ask you to choose how it works, in which mechanism, or they can ask the side effects, or they can ask drug of choice. Growth hormone drugs is very, very important, and oral hypoglycemic agents and insulins, gout and rheumatoid arthritis drugs. Hematology, drugs and its classification is very important. I think in that book I've given in a very clear manner the hematology drugs and its class. Anti-neoplastic drugs, mechanism of action and side effects, and the different types of regimens used in different cancers. In microbiology, various culture media, gram stain, acid fast stain, sterilization techniques, immunology, you should know it completely, and immunodeficiency disorders, prions and its diseases, differences and reproduction methods of viruses and bacteria. Then in bacteria, the important bacteria that you should study are staph and strep, Bacillus, Clostridium, Mycobacterium, E. coli, Vibrio, Rickettsia, and Chlamydia. In virus, herpes, all the types of herpes virus, human herpes virus, hepatitis B and C, Japanese encephalitis, dengue and chikungunya, yellow fever, and influenza. In fungi, dermatophytosis, mycetoma candida, cryptococcus asper and mucor, pneumocystis, parasitology, amoebiasis, giardiasis, malaria, schistosomiasis, and tinea. And in nematodes, all the worms that you should know. ENT, it is important to know the anatomy of middle ear, and inner ear as well, then laryngopharynx. So basically in anatomy, these are the very, very important topics in ENT. So facial nerve and its identification methods is very important. Make sure you should know about the facial nerve completely. Pharyngeal arches anatomy, Weber's and Renate test interpretation, and different types of ear test, autoacoustic emission test, and electrocochleography, that is ECG here, Bera tympanometry. In otitis media, acute, serous, and chronic, nasal polyp, CSF rhinorrhea, atrophic rhinitis, and JNA. It's very important. Nasopharyngeal carcinoma, laryngeal nerve and its disorders, vocal polyps and cysts, functional disorders of vocal cords. So these are the very, very important topics from ENT. In ophthalmology, for the anatomy part, make sure you know about the cornea and retina, the different layers and its significance, and embryology of eye, Horner syndrome, visual field defects, neuro-ophthalmology disorders, cataract completely, glaucoma completely, myopia and hypermetropia, diabetic retinopathy and its findings, hypertensive retinopathy and findings, CRAO, CRVO, retinitis pigmentosa, that is CRAO is arterial occlusion, and central retinal vein occlusion, uveitis completely. In forensic medicine and toxicology, types of mechanical injuries, hypothermia, hyperthermia, burns. This is very, very important. Questions are frequently asked from this. And then ballistics, entry and exit wounds, range of weapons, you should know that. Asphyxial deaths, hanging, drowning, strangulation, identification of age and sex, teeth eruption, fingerprints identification, postmortem changes. In toxicology, you should know about gastric lavage, when to give and whom you should avoid gastric lavage, and organophosphatase poisons, lead poisoning, cannabis, cocaine, datura, sexual offenses and rape, IPC sections. In anesthesia, I think I've already covered in another video, that is the ASPRO topics. Make sure you watch that video as well. I will include the link in the description. So for ASPRO topics, I've covered in another video already. ASPRO is anesthesia, skin, psychiatry, radiology, and orthopedics. I've covered it separately in another video. You can check that. And for the other major topics, I've also covered it in a separate video. Medicine, OBGYN, PSM, pediatrics, and surgery. So I'll attach that link also in the description. Make sure you watch that video as well. For your reference, I'll just show the slides here. So I think I've told all the important topics of the 19 subjects that you will definitely need to know for this FMGE exam. So I've tried to correlate these topics with online or the offline coaching classes that you're going with. So you can easily correlate with your notes. But if you are just starting now, make sure you read at least these topics before you go to your exam, so that you can pass easily and also can get a very good score. If you are thorough with this, obviously you will have to solve the Q banks, and you will have to revise it at least one time. So just completing is not enough. You should at least revise once all these topics. So interested people can get the ebooks from me. So with this ebook, I will give these important topics, and the important topics that I have shown with answers and explanation. Plus, you will get the one-liners ebook and test series every week. You will get it. So that's all. Thank you.